Hi, everyone. Welcome to today's webinar. My name is Jennie Day-Burget, and I'm a Senior Communications Officer at the Robert Wood Johnson Foundation. I'm coming to your home from my home in Portland, Oregon, where I work remotely as one of RWJF's 2 West Coast staff members. We get a lot of rain in Portland, Oregon this time of year, but today it's shaping up to be 75 degrees and sunny. I hope it's that lovely or better at your house today. Now, I know we have several hundred people on the line, so let me jump right in. You, our grantees, are RWJF's biggest asset. Always, but especially during this pandemic, we believe in your leadership. Each and every day, in fact, we're seeing more than ever the role you all play in serving your communities, and we're humbled to continue to join you in our shared efforts to build a culture of health for everyone in this country during this pandemic and beyond. At RWJF, we believe that communication is a critical part of achieving our mission. And it's undoubtedly even more important as coronavirus rages on in communities across the country. To continue to support your leadership in this area, I'm excited to share that today, we're launching the Communications Toolbox, a website for our grantees with on-demand resources about getting your work in the hands of the people who can use it. Part of our Communications Toolbox is a monthly webinar series that will dig into different aspects of communications. For this first webinar, as you all know, we have invited our grantee, Frameworks Institute, to lead the discussion. With that, let me briefly introduce Dr. Nat Kendall-Taylor, Chief Executive Officer at Frameworks Institute, who you'll hear from today. Frameworks Institute has helped nonprofits communicate more effectively for more than 20 years, and Dr. Kendall-Taylor is an anthropologist by training. He understands people and how culture operates, and he has spent the last 2 decades studying public thinking on social issues. He is here to share with us how to reframe health and equity in the COVID-19 era. I invite you all to use the Q&A tool on your screen to ask questions. We'll have some time to take questions for the last 20 minutes or so near the end of this program. Nat, thank you so much for being here. I'm going to turn it over to you now.
Great, thank you very much, Jennie, and for the rest of the team that's supporting the webinar. I really appreciate it. So hello to everyone. Good day to you all, and I hope you all are doing okay and hanging in there. I'm really excited for this opportunity to get to talk to you, and I will use only about 40 of the next 60 minutes to talk with you, and then we'll have some time for Q&A at the end. I'm normally really excited to talk about framing kind of any opportunity I get, but this work feels particularly important these days over the last couple of months. And I hope to share with you some of the thinking that I've been doing and that my colleagues at the Frameworks Institute have been doing around issues of framing health, equity, and some other relevant issues. So just 2 quick thanks. The first is to thank all of you for choosing to spend some time here. I know everyone is super busy, and life is this weird combination of feeling like it goes on forever these days and never having enough time. So I'm really grateful for you all taking some time today to be here. And then also thank you very much, as I said, to Jennie and all of her colleagues at the Robert Wood Johnson Foundation, with whom Frameworks gets to do really cool, important work on framing issues. So I'm lucky here today to have only one goal for the next hour, and that is to try my best to be helpful to you all on this call. I hope I can take the work that we do at Frameworks and offer it up in a humble way that hopefully helps with some small part of what it is you are trying to do, specifically the way that you are communicating and positioning your issues in the current discourse to deal with the current issues that we are certainly facing, but importantly also moving out of this phase of the crisis, and how issue framing and communications can be and is such an important part of that process. So as you all heard in the introduction, I'm going to be talking about communications, but have absolutely no training in communications. I'm an anthropologist by background. I do a kind of anthropology that's called psychological anthropology, which means that for the last 20 or so years, I've been interested and have studied all over the world how culture influences the way that people think, how people use culture to make decisions and process information and reach kind of attitudes and opinions about important social issues. And what I'll be doing here today is really pulling from those 20 years of work that I've done, the last 13 of which have been at Frameworks, to try to make some important recommendations to try to be helpful in how we're communicating about issues right now. So what we're going to do is I'm going to very quickly first kind of set a common definition of what framing is, so that we're all kind of working off the same understanding. And then I'm going to move on to 7 really, frankly, what I think are critical ideas in terms of thinking about framing in the public discourse now. And then hopefully that'll get us to about 40 minutes into the hour, and then we can have some fairly robust discussion at the end, which Jennie's going to help me moderate and kind of curate questions. That's what we're going to do. I'm going to jump right in here and tell you a little bit about framing. So I think it's really important in any presentation about framing to establish a common shared definition, because framing is one of these concepts that has become, or one of these terms that has become so ubiquitously used that I fear it has lost any and all meaning it ever once had. And so for the next hour, when we talk about framing, when I talk about framing, really what I mean is, what I'm talking about is the choices that we all make in how we present information. And those can be really small and seemingly insignificant choices, like the pronouns that we use, whether we say us and them, or whether we say we, the verbs that we choose that imply agency of people or deny or remove that agency. And then really obvious things that we all think about, kind of the values that we advance to argue for why our issue matters and why addressing it is of such importance, the metaphors that we choose to explain how things work and to allow people to come into our conversations. So framing is about how all of those choices, big and small, have effects on how people think, how they feel, kind of the emotional development component, and how they act, kind of behavior. And so really simply, when you think about framing, it's how we vary the way that we present information, and how that variance has effects on people's perceptions and their behaviors on our issues. And so I'm going to give you just a quick example that comes from a seminal piece of research by 2 social scientists, Snyderman and Thoreau, from 2004. And this is experimental work, so it's conducted with a sample of Americans, nationally representative sample of Americans. And what they did is they took that sample of Americans and they split them into 2 groups, and half of the sample received a message, the message that you see on the screen right now, which was kind of about whether people were in favor or against allowing a hate group to hold a political rally. The second group received the same message, but you can see the variance. So the only thing that's different between these 2 messages is that the first one is framed in terms of free speech and the importance of free speech. And the second one is framed in terms of risk of violence, kind of a danger frame. And then everyone is asked whether or not they agree that this group should be able to hold the rally. And so the only thing, again, the only thing that's different are those words that you see in bold here, which is really the frame that's being activated. And what you see, in a way that you can probably foresee, is that those people who were presented with this information through the frame of free speech are largely supportive of allowing this group to participate in this way. However, those who received the same information framed through risk of violence have a dramatically lower degree of support for allowing this to happen. Again, so here you can see all that's different is a few words, the frame that's activated, and you get this substantially different outcome as a result. And so I'm going to be talking a little bit today about metaphors and the role of metaphors, particularly in explaining issues and how powerful that work is. But the metaphor that I've come to use and in thinking and talking about framing is that frames are kind of these keys that have the ability to either unlock conversations and ways of thinking and space for engaging in issues in productive ways, or they have the ability to lock that up, to shut it down, to close off productive engagement, motivation, consideration, understanding of issues. And so these frames are, they're not everything that matters, but they do play this really powerful kind of opening or unlocking, this enabling function when it comes to the power of what we have to say having the effect that we want it to. And I think we all know, again, a lot of what I'm saying in this presentation is things that I imagine a number of you think about very frequently. But we all know, I think, that the way that we present information, the values that we use, the messengers that we allow or do not allow to speak, the way that we present our data are incredibly important right now, and that they are, in some cases, life or death matters in terms of their ability to shape behavior and public policy. And I'm just going to give you a couple of the kind of framing choices that I've seen over the last couple of months that I think really highlight this and make it pretty clear. So the first, going back, this has kind of dropped out of discourse a little bit, but I think it's probably the cleanest example where you see this kind of framing effect is that when we talk about COVID-19, when we talk about the coronavirus as the Chinese virus, that is a specific way of framing it that has some definite outcomes in terms of perception and behaviors. It activates a very strong fear of other. It kind of becomes, kind of forces our perspective to be more kind of nationalistic and inclusionary or kind of isolationist in perspective. And you could argue that it kind of activates senses of racism and xenophobia, in this case, specifically with respect to Asian Americans. But I would argue that racism and xenophobia doesn't just end there, that it kind of spills over more generally in terms of how people think. Another one that we've seen a lot of and continue to see with maybe a resurgence in the past week are these kind of ways of describing the procedures and the measures and the stipulations that we're following as being draconian in orientation. And what that does really powerfully is that it leads people to think that what we are doing is surely an overreaction. It makes people resistant to receiving information and really creates a strong hesitance, a reluctance to act or to follow things that we are being instructed to do by public health bodies. Another one that we see a lot of, this is one that I'm really interested in, and we're going to talk about as we go a little bit, is this. There's actually two frames that are going on in here: the kind of protection or kind of vulnerability frames. And what we have found at Frameworks and a whole bunch of other social scientists have found is that this kind of vulnerability framing, while in most cases is done with the best intent, has these really unfortunate backfire effects in the way that it others and kind of positions groups that we're communicating about as being distant, apart, and distinct. It creates a sense of zero-sum thinking, where as soon as we've done that othering, we're kind of forced to think about resources as being finite, whereby any more for those groups over there means by definition less for me and my groups over here. And this kind of language, this kind of framing has been shown to be stigmatizing, not only in terms of the way that we think about the groups of reference, but also, and I think this is super important, in terms of the way that members of such groups think about themselves and their identity. And finally, one that we've been seeing a lot of over the last couple of weeks and really in the last couple of days, this idea that people of color are being infected and or dying at higher rates. And I think that, and I'll drill into this as we go through, but I think there is a strong tendency for these kinds of frames to activate a sense of health individualism and to kind of force people to rely on their stereotypes of certain groups and to assume that such differences in rates are a function of those stereotypes, rather than kind of more structural and systemic social determinants that are shaping this phenomenon. So while framing is certainly pertinent and in play and kind of almost in our faces, these days the importance of the concept predates the COVID-19 pandemic. And so we've done a lot of work on issues of early childhood and early childhood development. We've done most of this work with a group at Harvard University called the Center on the Developing Child, which has for the last 15 years really focused on how to take the science of early childhood and to translate it for people who are in policy and practice making positions to have their policy and practice be informed by what we know from the science. And one issue that this group has struggled, and early childhood developmental scientists more generally have really struggled with, is getting public buy-in for policies, public support for solutions that relate to issues of children's mental health and early childhood development more generally. And so this particular experiment was designed to see if we could address that, how you can position, how you can talk about, how you can frame issues of early childhood and child mental health more specifically, that makes people more supportive of the kinds of solutions that researchers, scientists, experts are finding through investigation as being effective in improving outcomes. So this particular experiment is part of a larger study. It's conducted with about 6,000 Americans selected to be nationally representative in every way that you would think, every demographic category: age, race, gender, race and ethnicity, political ideology, income, residential location, family type, and I can go on, but I won't. And each of these 6,000 people gets randomly assigned to one of three groups. So those randomly assigned to the first group read a message about an early childhood development program. It's about 80 words in length. And the message is framed, right? It's presented with a value at the top that's about future progress and social prosperity. So the frames are the thing that you see, excuse me, along the horizontal axis of the graph here. And so people who are exposed to this message read something like, it's important that we do a better job of addressing children's mental health, children's early childhood development, because, and we wouldn't say it in this way, children are our future, right? Their solid, stable mental health, their healthy development are key to our ability to make progress as a society, to be prosperous, to be successful as a collective. People in the second group read the same 80 words about the program, except that the lead in, the frame, the value that's evoked at the top is different. So instead of what I just said, people in this group would be exposed to something that sounds like, we need to do a better job of addressing child mental health and early childhood development because children are our most vulnerable citizens. They deserve our empathy, our compassion, and we must do better. And then those in the third condition read the program, but don't have a frame at the top. So it's kind of, as much as anything can be unframed, it's kind of unframed information. And then everyone, all 6,000 people, answer a set of questions designed to measure their support for these evidence-based solutions. And so what you see the next time I click my button here, or what you're going to see, is two, what I think are gorgeous green bars are going to appear on the screen, and they're going to show you the ways in which exposure, hearing, reading those different frames affects people's support for those solutions. And so when you do this, you see two, they're absolutely gorgeous, I know, green bars, and they show you two really different things. So first of all, that one, the first one, future progress, social prosperity, is increasing people's support for this set of evidence-based solutions. That's the good news. There is a framing dance that we do when we get these kind of results. I will not be doing it today with you on this webinar. But your eyes probably invariably wandered over towards the right-hand side of the screen where the news is decidedly less optimistic. So this value of vulnerability, and I've selected this experiment, not just because I know there's a number of you interested in children's issues, but I think this vulnerability issue generalizes across issues. People exposed to that frame not only became not kind of statistically indistinguishable from zero, which are those people who receive no message, but actually became less supportive of the solutions that were being proposed. So to translate that for you, if you're an expert or an advocate working on issues of early childhood development, child mental health, and you frame your content, your messages through this value of vulnerability, you not only waste those resources, which would be zero message, right? But you actually are using those really valuable resources in a way that disadvantages your goal as an expert, as a researcher, as a practitioner, as an advocate. So the interesting thing in a subsequent piece of research and analysis, where we looked at the field's external facing materials over a 3-year period, so their websites, the mission statements, the op-eds, the presentations, kind of all of this external communications that people did, guess which value is used in well over 90% of those communications. So this has to be a rhetorical question because you're all on mute, but it is the value of vulnerability. So in essence, what the field has been doing for quite a while, obviously without intention, is advancing a value that kind of makes logical sense, but that actually works directly against their goals, the goals that they have in the work that they do. So here you can see, and in the previous COVID examples I gave, that the way that we frame messages is of incredible consequence. It's not just kind of purple prose and flowery language that we choose to surround our incredibly solid sound pieces of data, but rather each of these choices can be the difference between whether we cut through or get swallowed up in our messages, whether we're able to kind of move thinking in a direction or close it down, whether we can engage people or whether our information shuts them down and maybe drives them even further in the directions of thinking from which they come. So now we're gonna get into the main part of this presentation here, where I'm gonna walk you through 7 things that I've really been thinking about a lot over the last couple of months in terms of framing right now in the current context in ways that are productive right now, as I said, but also in ways that I think can help set us up for the most productive trajectory coming out of this particular phase of the pandemic, of the crisis that we are in. So the first of these ideas is that it is incredibly important, and I imagine a number of you on this call are in the middle of this and thinking about it on a daily, hourly basis, is that it is incredibly important the choices that we make in terms of how we talk about individuals and individual responsibility and government, role of government and government responsibility. And so, we've learned a couple of things in research that we've conducted over the last 20 years about framing individuals and government and that kind of balance. And other people have as well, but there is a predictable result where if you frame government and government's role and responsibility through this idea that government is broken beyond repair, it's inept, it's incapable, skullduggerous, whatever other words you want to use to describe something that really doesn't work and is corrupt, you create these very powerful patterns where people disengage from thinking that there's a role for government and become hyper-focused on the role of individual choices and responsibility. They become much more open to privatization of things that most of us would argue are public goods and public responsibilities. And then they become very fatalistic when it comes to these large issues like the current pandemic, where it's difficult for individuals to kind of solve or remediate the situation. This one I think is really interesting and nuanced and maybe a little bit provocative, is that the number of times or the kind of frequency of these heroic individual frames that we are seeing, and a lot of this is in the context of kind of clinical context. And this is not me saying that people working in healthcare are not behaving heroically, but it is to say that when our framing focus becomes kind of solely and narrowly focused on heroic individuals, what this does in effect is it obscures the role of government, right? It kind of lets government off the hook and creates this understanding that the solution to the problems that we are in is individuals making heroic efforts and behaving in magnanimous and altruistic ways. When again, that is certainly part of it. But I think most of us on the call here would argue that that's not it, right? That alone is not gonna be the way that we find our way out of this. And then interestingly, when we're able to frame government as responsible, playing a unique and necessary role, and where we are able to hold government accountable without falling into that broken, inept, incapable frame, we see a very different reaction. So we see people's propensity to focus on individuals as being kind of tempered or balanced by a role for public sector and government. And we see people in a very productive way demanding action from those government agencies and public services. So when it comes to what do we do to kind of balance this individual and government situation, there's a set of things that I think we can advance in our communications that will work to advance thinking and action out in the world. And so the first is to really have clear calls for increased government action, and the kind of invoking the sense that government is responsible for doing things in situations like these. To explain the unique role that government plays in such situations that individuals or private corporations are ill-equipped or incapable of providing. To be really specific about what government needs to do, not just to kind of have these vague appeals to government responsibility, but really to be concrete and specific about what needs to happen and what needs to be done. And I think to be really concrete and specific about kind of from a critical perspective about what hasn't happened. I think that is a key part of these frames. Again, doing so in a way that doesn't kind of trip and fall into these kind of corrupt, incapable, skullduggerous government kind of frames. And this is also really important. While being critical and holding government responsible, I think it is also important to give people a sense that government can do these things. These are feasible. These are things that can happen, and areas where government needs to be held accountable. And then I would say, last but not least, these recommendations need to be put on kind of repeat cycle here to give them a chance to stand up to the frequency and robustness of this kind of individual focus on heroic actions. The second one is probably one, knowing some of the grantees on the call, that I hope is really useful, but maybe a little bit hard to hear, is that the data that are emerging when it comes to health disparities or social determinants, issues of racism in the systems that we're seeing in play right now, those data matter a great deal. But to be optimally effective, or in some cases to be effective and not ineffective, they require context, right? We need to build context around those data in a way that allow people to see what they're about, what they mean, why they matter, and what they say we should do. And so we've seen recently lots of data about COVID and COVID data, but specifically data about health disparities. And I think that when that data, or we know that when data is presented kind of unadorned or as kind of standalone data, people have a high tendency to tune out. And I think that kind of tune out has gotten worse and worse as we've gotten further into the crisis. And interestingly, there's a tendency to actually reinterpret that data if it's not framed effectively. So at the beginning, I kind of alluded this, but to take data about the differences between white and Black Americans or communities of color more generally, and to interpret that data in terms of what it means through people's stereotypes about particular groups of people, which is clearly not what we intend when we present that data, but that is a real and definite possibility. I'm going to give you an example from some of my favorite social science work that shows that really clearly. And instead, what we should be doing is providing that data in a context that allows, as I said, people to see what it says, what it means, why it matters, and what it points to. And that when we can do that, the effectiveness of data is kind of flipped on its head and becomes dramatically more powerful. People can see the point that we're making, they can connect with it, and they can be persuaded in a direction that we all see that data suggesting. So the work that I want to talk to you about is the work of two Stanford social psychologists, so a very famous, they're both very famous, but the first author of this work is Jennifer Eberhardt, who's a very famous social psychologist who works on issues of race and framing. And if people are interested after this presentation in race and framing, basically just go and read any one of her pieces and it will kind of blow you away in terms of how this works. But a lot of her work has been in the context of the criminal justice system and around framing race and inequities in the criminal justice system. And so she's got this one great study from 2014 in which she, again, kind of a sample of individuals, and she divides them into two. One receives messages, kind of the naked numbers message. So it contains stats about with specific reference to racial disparities in the criminal justice system. The second group receives basically the same message, but it's without the stats that are directly about race. And then she kind of measures people's support for policy. And what you see really powerfully is that those people who were exposed to the kind of unadorned data that speak to the racial disparities in the system, they actually become more supportive of punitive policies. So a lot of this work was done in California. People became more supportive of three strikes types of policies, and some of it was done in New York, where people became more supportive of stop and frisk policies. We've seen this effect in our work on criminal justice, where we've taken facts about systemic racism and we've presented those to people kind of unadorned. And what you see when you do that is that people become less supportive of addressing disparities, and they attribute causal attribution, the cause of crime in these situations, to the individuals about which the data has been presented. So they kind of essentialize groups and attribute individual responsibility. We found some values, kind of pragmatism, problem-solving values, to be somewhat effective in advancing these issues. But the interesting thing is that when you take those facts, the same facts, and you provide context for them with a value that allows people to interpret them, you get these most effective messages. So it's not really a question of, do we talk about race or not talk about race, but rather the way in which we talk about race. And that's something that we think a lot about at Frameworks. And there's a lot of other social scientists that do as well. But I think this is a really helpful quote from Eberhard and Hetty out of this work that says, stripped of context, standalone statistics may simply be used as evidence of the stereotype that Blacks are prone to criminality. And I think this happens, unfortunately, in the current context when it comes to health and health equity and health disparities. So the what to do's here are to first of all use values to bring people in and show them why the data that you are presenting matters, to be very clear and kind of telegraph the meaning of the data, that data, as much as we've heard otherwise, do not speak for themselves and should not be left to stand alone. That we can use a process called social math, which is largely the use of analogies to make numbers understandable and put them in people's everyday action scenarios. So the most common one is to take things like 1 in every 8 children in the United Kingdom experience abuse or neglect by the time they're 18, 16, and make that into the number of children in a classroom, right? So what this would mean is that for every classroom of X number of children, Y number of those children will have experienced this problem by the age that they graduate from high school. And I think this is a really important one. I think when you think about the way that data are used, they're normally used to show the extent of the problem, the severity of the problem, the reach of the problem, the depth of the problem. But there's another really powerful way of using data, which is to actually show something about the solution, right? There's a lot of data that speaks to the effect that given interventions or given solutions will have in addressing the problem. So it's really important not to fall into the trap of only using data to illustrate severity and extent of problem, but also that we can use data in a more efficacious way to show that there are solutions that would improve outcomes. So another thing that we've written a lot about and have been thinking about really carefully in the last couple of months, but well beyond that, is the importance of how we position groups in the way that we communicate. And I've kind of gotten a little bit into that in terms of the data point. But we found that, as I alluded to before, that when we frame groups as vulnerable, we immediately otherize those groups, and we kind of re-ingrain existing stereotypes that may be in a culture about a particular group. And again, if you go back and do an informal analysis of public discourse over the last 2 months, the extent to which vulnerability frames are used, and used clearly with good intention, but I would argue have unintended negative effects in terms of public thinking and behavior, it's really quite striking, the preponderance of these frames. Another one that we see a lot of is this kind of savior and victim framing that implies that there is a group of people who needs to make sacrifices for other groups of people. And this this type of framing has been found pretty clearly to, again, to stigmatize groups that are placed in that victim role, to create this zero-sum mentality in which once something is framed in that way, it's almost impossible not to think about the situation as kind of more for them, meaning less for me, which sets up a really unproductive dynamic. And that once you've established this frame, the only solution that's really possible is sacrifice. Another one that we see a lot of, so we also do a lot of work around aging and demographic change, and we've been thinking a lot about ageism over the last 2 months. And this worthiness frame is something that you see a lot of in terms of older adults and the way that they're covered in the media. And as soon as we establish this issue as some groups are worthy, we kind of imply that some groups aren't, which is a really unproductive place to get people. And we invite people unknowingly to evaluate the deservingness of particular groups of people, which I would argue is always an unproductive dynamic to establish in our communications. So in terms of what we do, instead of groups being liabilities to society, I think it is hugely important to talk about interconnection and interdependence as a strength of society. And you are seeing this in communications. And I don't mean to say, I should have said this at the beginning, that any of these what to do's are completely novel and not being done. There are groups, there are people, there are communications out there in the world that are really actively following these kind of best practices and endorsing and advancing these frames. Instead of the kind of victim, savior, sacrifice frame, I think you can instead appeal to a responsibility that each one of us has to all people. And that is a more productive way to engage around that. To frame in terms of connecting with common experiences that people have, and to really avoid ways that we communicate that imply difference and kind of othering. And a lot of this is about pronouns, them, they, those, and you look at the frequency of those pronouns and how they activate this othering rather than this connection. I think there's a way of talking about there's a different way of doing the sacrificing, saving thing, which is about encouraging and talking about everyone needing to step up and do the right thing. That again is a subtle variation on that, but is, when it comes to the framing effect, dramatically more effective. And I think there's a way of advancing, and I have principle here in italics because I'm not recommending using the term targeted universal, but I am recommending using the principle of targeted universalism, which is to kind of talk about general principles at work and then pivoting to show how particular people or places have particular risks and specific needs within the broader context that need to be addressed. The fourth idea, and again, I've alluded to this a little bit, and I think this is a really powerful one that I'd love to see kind of change going forward, is the importance of finding a balance between the urgency of the situation, how dire and on fire and big and heavy things are, balancing that with a sense of efficacy, that there are things that can be done that would improve it, that this isn't just all crisis and no remediation, no solution. So we found, this is a strong finding, primarily in social psychology, that when messages go all in on urgency, crisis, 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 right? So these typically would look like statement of crisis, data that illustrates crisis, story of crisis, example of crisis, more data about crisis, and then you're lucky if you get a little bit of solution, and it's always at the end and it's always just a little bit. That those kinds of messages powerfully get people to disengage. They evoke this sense of fatalism, that everything is too dire and on fire for us to do anything about, and therefore I'm not going to engage, and peace, I'm out, I'm moving on. Instead, the answer is not to go all solutions kind of woo-woo, we can do this, rah-rah. And when you do that, and I would argue, especially when you do that in the current context where there is a crisis, people will reject your message outright. And even if they don't reject it outright, that kind of message, when taken in, creates a very limited degree of motivation. And we have found consistently that when we're able to get this balance between the two, we bring people in, we encourage engagement, and we motivate action. So the idea here is to, when you can, to bring a solution into your communications, not just to drop it and forget it, to explain how it works, how doing this thing leads to an improved outcome. That our tone is incredibly important, that we need to communicate that there are solutions and not just problems. And if we can, so there is an important caveat here, which is not forgetting that urgency part of the equation, that if you wade in and you're all about solutions, I think you're very likely to kind of sound off and kind of like you haven't considered the gravity of the problem. And I would say that this is especially important when it comes to communicating about structural racism and race equity, where if you don't have the urgency, you're very likely to evoke this way of thinking about race in the United States, which we call historical racism, that it's kind of something of the past that we've legislated out, which is clearly not where you want to be, right? People need to be reminded that this is a situation now that is urgent. But without that efficacy component, you're likely to leave people feeling like there's nothing that can be done about this deep systemic problem. So the fifth one, and I'm getting close to my time, I'm watching it, is the power of explanation. And in some cases, we can even think about this as kind of like a superpower that we have as communicators who study these problems and do understand how they work. And so we've seen a dramatic difference between messages over the last 2 months, or however long it's been, I've kind of lost track, that are really about kind of do what we say messages, and the way in which those messages are frequently rejected and result in disengagement. And the difference between a do what we say message and a see how this works message is pretty substantial in terms of the way that people support solutions, their engagement with issues, and their efficacy. And so what to do here is to take the time, and it doesn't mean a dissertation, but to focus attention on explaining why these problems exist and how they work, to show what solutions do, not just to drop a solution, but to unpack it and really show what it does. I've got a graphic here that I'm gonna skip over. And we have found in our work that the use, when it comes particularly to kind of race and racism and equity, that the use of historical exemplars that explain why we experience current problems of race and racism are really powerful in providing people with some explanation around why these things work. I'm going to skip this. We can go back to this if people are interested. So the sixth and penultimate idea here is kind of framing ahead and being really careful about how we position issues moving forward. And so we've seen a lot of things. I've seen a lot of things that I'm kind of worried about in terms of the way that people are positioning now for later, that I want to just call your attention to. So one is this kind of winning or seizing kind of overly strategic way of talking. And I think that what that does is it just reminds people of competition and invites them back into a kind of partisan thinking that I think we want to avoid at all costs in the current moment. There's also tons of language around kind of bright spots or opportunities or silver linings. A lot of interesting to see how often that word silver lining, those words silver lining are used. And I think what that does is it allows people to kind of see you as tone deaf, to see you as opportunistic, and then creates this really high likelihood of a backfire effect. And then the other one that you see a lot of is this kind of, let's burn everything to the ground going forward and change it all. And I think there's a very small percentage of Americans who are kind of with you when you talk in that way. And so the things to do are what I've talked about, kind of response and support rather than taking advantage, moving forwards together rather than this oppositional language, this competition language. I think the importance of being aspirational and talking about what is possible is incredibly important. And then going back, I think it's really important that we don't forget to bring our solutions to the conversation. And I'll just lead out with this. I think that given what I just said about not talking about opportunities and silver linings, I think that there is a sense in which the situation we are in right now is incredibly important for how these issues, whether it's early childhood and families or health equity, how those issues play and move into the future. So we've seen, and there's a ton of historical examples, whether you talk about 9/11 or the Great Depression, where these kind of periods of flux and confusion, where you've got ideas that are kind of being contested, are times when discourses shift and change, and ideas and mindsets shift and change coming out of these situations. And so I have my eye on a set of issues that I think are in flux, where the way that we communicate about them are incredibly important. And government and the role of government is one of them, big time. Health equity is another one where I think there is a significant flux, and how we talk about these issues is incredibly important. I think data, privacy, artificial intelligence, specifically related to public health, is a huge one. One that I live on the daily is kind of education and learning, and how these issues are up for grabs in interesting ways. And then I would argue, perhaps most importantly, how we think about labor, work, and the economy is really in flux. And so I'm going to end with one of my new favorite framing quotes from Charles Eisenstein, who said that the world as we know it is built on a story. To be a change agent is first to disrupt the existing story of the world, and second, to tell a new story of the world so that people have a place to go. So Jenny, I'll stop there, and we'll be glad to have your help in curating some questions. It looks like there's a few of them coming in. But thank you all very much. I appreciate it.
Yeah. Well, thanks so much for that thought-provoking presentation. I know I learned a ton. I took copious notes all over my desk here. We have about 15 minutes for Q&A. So if you have a question that you haven't already put in the Q&A, make sure you do it now. We may not get to all of you, but we will get to as many of you as we can. Now, the first question that I saw come in many different varieties was around your thinking about how we talk about what you called people of color being infected or dying at higher rates from coronavirus. That's so important to so many of us on this webinar, because we were working on issues related to equity and health disparities. Can you talk a little bit more about your specific recommendations for addressing this topic, maybe from an asset-based frame or otherwise?
Yeah, so there is actually a piece that I think, since I'm not going to have a chance to kind of fully unpack that, a colleague and I wrote a piece in the Chronicle of Philanthropy about a week ago that's really about important ideas for framing specifically race and health equity. So I would maybe we can provide a link to that or send it around afterwards. I think that'd be a great place to go for people who are interested in that. I mean, I think that it's the idea, it's that quote that I read, it's the context piece that's so important. We have to be having conversations about race and equity in this current context, so please do not interpret me as saying otherwise. But there are all kinds of different ways of having those conversations. And I think that what I see with a high degree of frequency is I see these numbers, these disparities statistics that are presented, but not really framed or given context. And so some ways of giving context are framing those data with a value that show that this is an issue that affects us all. It kind of has causal roots in things that we're all part of, and addressing it is an issue to us all. So kind of trying to bring people in and identify with the issue, and not let them do what we as humans are really good at doing, and kind of immediately otherize and see that it's not about my people, and so I can kind of put it over there and not engage with it. And then I think a lot of it is about explanation. So making people even a little bit smarter about why these disparities are being seen. And so I shouldn't do this, but I watch CNN for about 15 minutes every morning when I get up, and there was a public health expert on who did this beautifully this morning. So introduced the data, but immediately unpacked the idea of social determinants, and how things like transportation, housing, kind of the way that communities are set up, are part of the reason why we are seeing these disparities in the data. So he didn't, this medical professional did not let those data kind of stand alone, but he provided context largely through kind of some explanatory communications that allowed people to see why they are, which is so important because that's the thing that keeps people from essentializing those groups in ways that are highly unproductive, and allow those stereotypes to kind of get back in where we really do not want them to be.
Great, thank you. I'm going to switch gears just a little bit. Nat, a year ago or so, I worked with your team at Frameworks to map the gap between narratives we often use to talk about hunger and food insecurity and narratives that might actually work better to talk about hunger and food insecurity. When we were doing that, I found that the concept of mapping the gap was really sticky. I really loved it. And I'm totally putting you on the spot here, but I'm wondering, can you identify one big gap? This is kind of a summation idea from you to summarize everything we've heard today, but one big gap that you think that needs to be overcome or kind of mapped in our current popular narratives related to health equity and COVID-19?
That's like a high level mastery question there. And it puts me on the spot, but I think it's fair. And I think about this stuff all the time, so it's not putting me that much on the spot. So for people who are unfamiliar with that phase or think it's something that you do when you enter or exit the tube in London, mapping the gaps is taking kind of a set of positions that we as a field want to be able to advance. And we compare that to kind of the way that people currently think about that issue. And so one that is really, I don't know if it needs to be mapped, I kind of know it's there, is this difference that that we have on this call, I imagine, between this understanding that the issues that we are dealing with and the solutions that are necessary are structural, right? They come from systems and resources and policies and decisions that were made about how to allocate those things. And I think for most people, there's a tendency to see these issues and to be most comfortable thinking at that individual level. So I think that really, you can see it in that first point that I make, kind of the difference between, or the importance of how we talk about individuals and individual responsibility and government and systems responsibility. I think that for most of us, we're really kind of well-versed in thinking about systems and public responsibilities. And I think that for most people, those ways of thinking are kind of really under practiced, and we're much better in thinking about kind of bootstraps and John Wayne and Jay-Z and all of these ways that we're familiar understanding how problems should be solved. And so in the current crisis, you really see that gap emerging strongly, right? But I also think there's some hope in bridging that gap in the current situation, because if there ever was an illustration that is clear and in your face that it is not about individual discipline, will, and responsibility, and that there are population and systems things going on, it seems like this is a pretty illustrative example of that other way of understanding issues in the world.
Great. Another question that came in our communications research on obesity, we found that acknowledging the role of personal responsibility, even just a nod to it, makes people much more receptive to messages on collective action, environmental drivers, and the role for government. Have you seen a similar effect with COVID?
So I think the principle is really important. So this is something that makes framing communications even more complex. And so I've got a couple of examples. One of them is, I think, obesity. So we're doing some specifically childhood obesity framing in the UK right now. Our research would comport and validate what you just said. So if you don't acknowledge the kind of existing way that people model the issue, if it's not included whatsoever, if you don't nod to it or signal at it, there's a high chance that people will reject your message, basically thinking that you don't understand what's going on, or that you're so far from them that they can't even be with you at all. But I think the key is to do that in the right place in a message that doesn't set that as the frame through which people process the rest of the message. So when we make recommendations around that, we kind of think about leading with the thing that you want people to believe, and kind of establishing that really strongly as the frame. And then there's some acknowledgement of current understandings that's necessary. But the interesting thing is that what you see so frequently in communications is that people do that the other way, right? So they begin with the acknowledgement of the miscommunication. So this happens a lot when it comes to the vaccine debate. So people acknowledge the misperception, and then they think they can come after that and correct it. And there's lots of work on misperception correction that shows that kind of that ordering is pretty unproductive or counterproductive. But that if you flip it, if you lead and repeat the thing that you want people to believe, and then acknowledge the kind of current thinking, that those are some of the most engaging and persuasive messages. So that's a very long way of agreeing that, that's really important. The other place that we see this, I know there's some people who work on children and families. There's a strong tendency in the US to think that families are all that matters for young kids, and kind of to kind of become blind to the other elements of context that matter. But if you have, so you don't want to lead with parents and families, but if you don't acknowledge the importance of parents and families in messages that are about communities or context, people will outright reject your message. So it's this kind of complex dance between leading with the thing that you want people to think, but also having to acknowledge and kind of connect with current understandings.
That's great. Another question from the webinar participants: how does this fit in with the recommendations about how using storytelling to be persuasive because it creates empathy? Is the research showing that people are less responsive to the human story at this point in time, or is there some other much better explanation? It looks like your data shows that people are now responding quite differently.
No, I mean, I think that, narrative and story is fundamental to the way that our psychology has evolved. Like, we are storytelling creatures. We are much more likely to kind of hear and receive information when it's delivered via story, to remember it, to be able to pass it. So that hasn't changed in the last 2 months. But I think what's really important is the kinds of stories that we tell. So what I would love to see is people kind of thinking about, I've got to tell a story, and you always have to tell a story. But can you tell a story that advances or articulates some of these recommendations and ideas that we've talked about in this webinar? Can you tell a story that that explains housing inequities by referring to the historical, or not to the example of redlining, right? Can you do explanatory work in your story in an engaging way? Can you have stories that are about interconnection and responsibility rather than sacrifice and victims and saviors? So I really think that the idea of storytelling is kind of like it's a given that comes over everything that I've said, and the challenge is to think about how you tell the most effective stories, how you frame your stories most effectively using some of the things that I've talked about.
That's
You're
great.
not going to get me to say that stories don't matter, for sure. I'm not going to be on record saying that one.
Well, that's a relief. Well, all of you, we didn't get to all your questions. We are nearing time. We only have about 90 seconds left. But I want you to watch for a follow-up email where we will try to address some of the bigger themes that were asked about today. Also, you should note Frameworks has a lot of good information on their website, and they consult with nonprofits like you all throughout the world. If you have something specific you'd like to discuss with Nat or one of his colleagues, I encourage you to reach out to them. The email is info@frameworksinstitute.org. And again, Nat, I think I speak for everyone in thanking you for being here. You have given us a lot to think about and work on. To everyone on the webinar, thank you so much for your participation. We hope that you'll be back for our next webinar next month, when my colleague Jordan Reese offers advice on working with the media. Goodbye.
Thank you all very much.